Thank you very much for participating in the RAMBAN-1 study. I'm Kate Chang, junior scientist and co-founder for Care Biosciences. Dr. Ajay Gupta is the Chief Medical Officer for Care Biosciences and will be speaking with you today about the use of Ramatroban as a treatment for COVID-19 and to prevent the long-term sequelae of the acute infection, referred to as long COVID. I'd like to introduce Dr. Gupta. Dr. Gupta is a clinical professor of medicine at University of California, Irvine. He grew up in the walled city of Old Delhi and went to medical school in the All India Institute of Medical Sciences, getting his MBBS degree in 1980 and MD medicine in 1983. He subsequently moved to the UK and then the US. In addition to Ramatroban, he has invented two other drugs that he has taken from bench to bedside. These are the only two drugs invented by an Indian that has received US FDA approval. At the beginning of the pandemic, Dr. Gupta postulated a lipid mediator storm in COVID-19, which has subsequently been confirmed. I will now hand over the forum to Dr. Gupta for his very brief presentation.
Thank you, Kate, and thank you very much for your participation in the RAMBAN-1 study. It's a pleasure to speak with you regarding Ramatroban and its use for COVID-19. Back when the pandemic just started in March 2020, looking at the clinical features of the disease, specifically the lymphopenia and the microvascular thrombosis, I postulated that this was a COX-2 mediated disease and prostaglandin D2 and thromboxane A2 were playing a critical role. I also postulated that Ramatroban, the only known drug that specifically blocks the action of both thromboxane A2 and PGD2, would be useful in this disease. It was subsequently shown by investigators from Quebec, Canada, that indeed there is a massive thromboxane and prostaglandin D2 storm in the lungs of patients with COVID-19 pneumonia. You can see in the left panel, the thromboxane levels in the bronchoalveolar lavage fluid are the highest ever recorded. And in the right panel, you can see the prostaglandin D2 levels are very high compared to healthy controls. Other studies have also demonstrated massive increase in the plasma levels of both thromboxane and PGD2 in COVID-19. Thromboxane stimulates the thromboxane receptors or the TP receptors and thereby activates the platelets. Thromboxane is converted to thromboxane B2, which is then converted to 11-dehydrothromboxane B2, which again goes on to stimulate the prostaglandin D2, DP2 receptors, which are, of course, directly stimulated by prostaglandin D2 as well. And the result of these receptor activation is pulmonary edema, hypoxemia, brain fog, thrombosis, lung fibrosis, and the survival of the coronavirus. Ramatroban, the only known dual receptor antagonist of both thromboxane and PGD2, DP2 receptors, has been used in Japan for the treatment of allergic rhinitis for the last 22 years. It's a very safe drug, a very inexpensive drug, which is available as a generic. We tested Ramatroban in the animal model, in the Syrian hamster animal model of COVID-19, and found that Ramatroban reduced the viral load in the lungs, as you can see in the left panel. Also, in the right panel, you can see that Ramatroban reduced the lung weight because of reduction in the lung inflammation. We also had the good fortune to be able to treat 4 patients in India with this drug. The first patient is my own mother, 87-year-old, who had hypertension, stage 4 chronic kidney disease, coronary artery disease, and had had a cardiac arrest due to acute myocardial infarction about 5 years ago. So she was at very high risk of morbidity and mortality when she got COVID-19. She was admitted to a hospital in Indore and did not respond to remdesivir and dexamethasone. We subsequently treated her with Ramatroban, leading to her rapid recovery. I'll describe to you another patient, the second one on this list, who was a 33-year-old male in Dwarka, a suburb of Delhi. He had hypertension, psoriasis, and recurrent upper respiratory tract infections in his past medical history. He developed severe COVID-19 pneumonia. His SpO2 dropped to 73%, and no hospital bed was available. This is during April 2021 Delta spike in India. In fact, oxygen cylinder also could not be procured. He was in extreme distress. Ramatroban was sent to him by Uber at midnight. At 1:30 in the morning, he took the first dose of Ramatroban. By 3 o'clock in the morning, he had some relief. He fell asleep. And when he woke up at 11 o'clock in the morning, his SpO2 had gone up to 90%. There were 2 other patients who were treated with acute COVID-19, and all 4 of these patients, they made an uneventful and very rapid recovery with Ramatroban. So therefore, we expect that your patients who are hospitalized with COVID-19 pneumonia should have a very prompt response to Ramatroban. The reason this response is so rapid is that thromboxane in the lungs leads to severe pulmonary venous constriction and not the arterial constriction. This is the pulmonary vein, and here is the artery. And you can see the vein is severely constricted by the action of thromboxane. This leads, in the right panel, this leads to pulmonary venous constriction, which leads to increase in the pulmonary capillary pressures and pulmonary edema. When we give Ramatroban and block the action of thromboxane on the pulmonary veins, leading to pulmonary venous dilatation, this decompresses the pulmonary capillaries, reduces lung edema, the alveolar fluid is reabsorbed, lung edema is relieved, and hypoxemia is relieved. Ramatroban may have a role in long COVID syndrome as well. Serum was taken from patients who had COVID-19 myocarditis. This convalescent serum was used to incubate the arterial endothelial cells. The serum led to endothelial cell inflammation and increase in IL-6. This was inhibited by the addition of Ramatroban, as you can see in the third bar. Therefore, Ramatroban can reduce the arterial inflammation and injury during acute COVID-19 and also in convalescent COVID-19 patients. The basic pathophysiology of COVID-19, which involves rapid viral transmission, a maladaptive immune response, such as the immune response is as if it's targeting a helminth rather than a virus, a type 2 type of immune response, and also thromboinflammation and microvascular thrombosis. All these mechanisms are targeted by Ramatroban by counteracting the effect of thromboxane and prostaglandin D2. Ramatroban, as I have mentioned previously, not only works during acute COVID-19, but we expect and suspect that it will be helpful in long COVID as well. Aspirin has been tested in COVID-19 with variable results. Ramatroban is 50 times more potent than aspirin in inhibiting platelet aggregation. Ramatroban has also been tested in another model where there is a prostaglandin D2 and thromboxane storm in the lungs. And this is the mouse model of silicosis, where the mouse inhales the silica dust. Ramatroban in this model reduced lung inflammation and reduced lung fibrosis. We all recognize that patients with COVID-19 pneumonia, when they recover, are at risk of developing lung fibrosis. Therefore, it is quite possible that use of Ramatroban during acute COVID-19, as will be tested in the RAMBAN-1 study, could reduce lung fibrosis in the convalescent period. And also it's possible that if patients with long COVID are treated with Ramatroban, that it could potentially reduce the lung fibrosis and other manifestations of long COVID. Ramatroban is a very safe drug. There is 22 years of experience using this drug in Japan. The serious adverse reactions are rare. Prolongation of bleeding time is the expected pharmacological action of the drug. Bleeding is rarely reported. Most of the bleeds are minor. Very importantly, the drug can increase the liver function tests, the transaminases, and alkaline phosphatase. Therefore, these should be monitored during the clinical trial. Less than 1% of patients treated with Ramatroban have elevation in liver function tests. The rationale that I have outlined for you strongly supports a trial of Ramatroban in acute COVID-19, especially in patients who are hypoxic. And this is the subject of the RAMBAN-1 study. This is a randomized, double-blind, placebo-controlled, multi-center trial, an adaptive phase 2, phase 3 study to evaluate the efficacy and safety of Ramatroban compared to the standard of care in hospitalized patients with COVID-19. Our funders recognized the need for such a study, and we are grateful to them for that. Our funders are Open Philanthropy, a partner of Bill Gates Foundation, and BARDA, which is a US government agency which funded the Moderna vaccine. These agencies have funded RAMBAN-1 because it serves as a proof of concept that is applicable to future pandemics as well. I would like to thank you again for your commitment to advance medical research. This drug could be India's contribution to the world. You will appreciate the drug is Ramatroban or Ramatroban, and the study is appropriately called RAMBAN-1. So thank you very much and namaskar.